Pharmacology 2, Unit 3. Topics are cardiovascular and hematology. This starts in Chapter 9. Hypertension or high blood pressure. Risk factors are hereditary, race, age, alcohol abuse, increased salt intake, obesity, oral contraceptives. Hypertension can be caused by poor heart action, arterial sclerosis, renal failure or kidney failure, narrowed blood vessels, chronic stress or unmanaged stress. And what are the consequences of untreated hypertension? It can result to renal failure, organ failure, poorly perfused organs, vision problems or blindness, diabetes, peripheral vascular disease, stroke, heart attack, also known as myocardial infarction. There are two different types of stroke: ischemic and hemorrhagic. What are some things that a person can do to help reverse hypertension before a person starts looking to take medication from a physician? They can look at doing weight loss, dietary changes, decreasing the sodium intake, decreasing carbs in order to decrease the caloric intake, increase exercise, change their stress management in order to have better stress management strategies, smoking cessations, counseling, meditation, and many other things that I have not mentioned. HMG-CoA reductase inhibitor drug, also known as statins, lower blood LDL levels by lowering the production of cholesterol. They do not remove dietary cholesterol from the blood. The examples of this drug is atorvastatin, Lipitor, pravastatin, known as Pravachol, and simvastatin, known as Zocor. This medication is best absorbed if it's taken on an empty stomach, as well as taken at bedtime when there is no food in the patient's stomach. The patient should be instructed to have exercise, low-fat diet, continue to manage their stress, and to continue taking the medication as well as keeping their appointments with their lab work. The objective is to continue lowering the cholesterol levels as well as managing the changes in their lifestyle modifications. Heart failure, also known as HF, previously known as congestive heart failure, also abbreviated as CHF. This is where the heart muscle fails to push normal amounts of blood through the body. It leads to fluid backup, which increases the workload on the heart. Congestive heart failure, or heart failure, creates the signs and symptoms of anxiety, restlessness, cyanosis, clammy skin, tachycardia, left lower extremity edema, a persistent cough. The patient will lean forward and have a forward-leaning posture. These patients usually cannot tolerate lying flat in bed. They need multiple pillows to prop themselves up. And these are patients that are frequently sitting in recliners, sleeping versus lying in bed. You may even find that these patients do not have beds in long-term care, but instead they have a recliner as their bed. The primary treatment for heart failure, which is the main treatment goal for heart failure, is to improve the heart contractility, which will improve the cardiac output. Remember, it's the heart muscle that is failing to push out the normal amount of blood throughout the entire body. This is the patient that you're going to see cyanosis on the fingertips, cyanosis on the extremities of the toes. You're going to see poor perfusion. You're also going to see the coolness to touch, not see, but palpate the coolness to touch on these distal extremities. And you're going to also have difficulty palpating the pedal dorsalis pedis pulses. And you're also going to see a decrease in the pulses. You're going to find that the distal pulses are more weak. Patients that have heart failure usually will have hypertension, fluid overload. They also would have dysrhythmic heart rate or irregular heart rate, and they would have a fluid overload. Combination of drugs used from different classifications are used together to create a synergistic type of treatment. A patient may be on one drug from one classification and another antihypertensive drug from another classification and a diuretic. And in combination, these drugs are used to treat a patient who has heart failure. And synergistically, these drugs placed together would be a therapeutic treatment for a patient who has heart failure. A drug from an ACE inhibitor classification and or angiotensin receptor blocker and or beta adrenergic blocker and or calcium channel blocker and or cardiac glycoside and a diuretic, either a loop, thiazide, or potassium sparing. Diuretics work to slow the heart rate, relax the blood vessels, and decrease the blood volume. Remember, when using any type of diuretic or any antihypertensive drug, the blood pressure and the pulse are assessed. If the blood pressure is less than 100/60 or the pulse is less than 60, these medications are all withheld. The healthcare provider is contacted and further orders are obtained in order to treat the patient. These medications cannot and should not be given if these vital signs are less than this parameter for safety reasons. Digibid, known as digoxin, and isorbid mononitrate, known as MDIR, have the most significant impact on heart contractility. When a patient is diagnosed with a dysrhythmia, it means that there is an abnormal heart rhythm. that places a patient at risk for blood clot formation. The patient is usually at higher risk for a pulmonary embolism or a DVT. The patient is placed on a combination of drugs, a drug that will help with the heart rhythm and an anticoagulant, such as Coumadin, or also known as a vitamin K antagonist. Cardiac glycosides are for heart failure. They decrease the speed of the conduction of the heart. They help the heart beat stronger and more efficiently, increases the force of the myocardial contraction. They slow ventricular heart rate. Example of this drug is digoxin, also known as Lanoxin caps. Lanoxin, you may even see it as Digibid. It is extremely important to make sure that the heart rate is auscultated by a stethoscope for 1 full minute before administering this medication initially. The heart rate needs to be above 60. After the patient has been stabilized on this medication, the patient can then be assessed by a radial pulse for 1 full minute before this med is administered. The heart rate still needs to be above 60. If at any time the heart rate is below 60, this medication must be held. There is a digoxin level lab that must be monitored. It is extremely important to make sure that it is drawn on a scheduled basis as the physician has ordered. If there is not an order for a dig level to be done, it is the nurse's responsibility to obtain one. The ongoing assessment for the symptoms of dig toxicity is important and is upon the responsibility of the nurse to monitor. Those symptoms could include anorexia, visual disturbances, hallucinations, and other symptoms. A digoxin level ranges from 0.5 to 2.0 nanograms per deciliter. A loop diuretic, the most potent diuretic, act on loop of Henle to inhibit sodium and chloride reabsorption. The loop and thiazide diuretics cause loss of valuable potassium, and they may require supplemental potassium. An example of a loop diuretic is furosemide, known as Lasix, and bumetanide, known as Bumax. A loop diuretic is a drug that increases urine output by blocking active transport of chloride, sodium, and potassium in the thick ascending loop of Henle. Loop diuretics, also known as high-ceiling diuretics, are widely considered the most powerful of the diuretics. Use can result in significant decrease in fluid volume and increase in urinary output. The loop diuretics are used in a variety of conditions, including heart failure, pulmonary edema, and cirrhosis of the liver with ascites. Potassium is one of the major electrolytes that can be lost after loop diuretic administration. Monitor the potassium levels carefully because significant changes in potassium can result in cardiac dysrhythmias. Loop diuretics. It's the most potent diuretic. It acts on the loop of Henle to inhibit sodium and chloride reabsorption. Loop and thiazide diuretics cause a loss of valuable potassium, usually requiring supplemental potassium. Examples of loop diuretics are furosemide, known as Lasix, Bumenidine, known as Bumex. These drugs should be given early in the morning and early afternoon. These drugs also increase urinary output, but they also lower blood pressure. The fluids that should be avoided when loop diuretics are prescribed are alcohol, coffee, beer, and soda. Any fluids that are natural diuretics. A side effect of loop diuretics is dehydration and hypotension. Potassium supplement is a mineral and electrolyte. Potassium chloride, also known as K-tab and K-dur and micro-K. Anytime that this is a tablet, understand that it should not be crushed. It can be placed in applesauce or a little bit of water, and it can be dissolved this way, but it should not be crushed. These are micro beads and they are micro extensions, and crushing them can destroy their properties. Please make sure that you check the potassium lab value and know what the normal range of that is. Patients that have a level that is below therapeutic level can have dysrhythmia, and above therapeutic level can have dysrhythmia. 3.5 to 5.0, anything below or above can cause dysrhythmia. Thiazide diuretics. Diuretics clear excess fluid from the body. For decreased peripheral vascular resistance. Most common class of diuretics decrease sodium and chloride reabsorbed by kidneys. Examples of these drugs are hydrochlorothiazide, known as hydrodiuryl, and chlorothiazide, known as diuryl. Muscle weakness can potentially be a sign of hypotension and or dehydration and should be reported to the healthcare provider immediately. Another class of diuretics is potassium-sparing diuretic. Its action is that it interrupts the sodium-potassium exchange in the distal tubule, sparing potassium loss. Examples of this drug is spironolactone, known as aldactone, amiloride, known as mitamor, and triamterene, known as direnium. A potassium-sparing diuretic is a drug that increases the excretion of water and sodium, leading to increased urine output without the loss of potassium in the urine. They are called potassium-sparing drugs because they do not waste potassium, which often occurs with thiazide and loop diuretics. Potassium-sparing diuretics act by slowing the sodium pump in the collecting duct of the nephron so that more sodium and water are excreted as urine. Potassium-sparing diuretics interrupt sodium-potassium exchange in the distal tubules, sparing potassium loss. Examples are spironolactone, aldactone, amiloride, known as mitamor, triamterene, known as direnium. So because this potassium-sparing diuretic can leave behind potassium, it can cause hyperkalemia. Because the potassium can rise in the body, it can cause a dysrhythmia. Dysrhythmia can cause heart palpitations. It is a diuretic. It can increase urinary output, excreting extra fluid. It can create dehydration or contribute to dehydration, and it can cause hypotension or decrease the blood pressure. Patients that take antihypertensive medications and diuretics should understand the importance of weighing themselves on a daily or weekly basis to report significant weight gain or significant weight loss, to not make abrupt changes in their position, to report any dizziness, to make sure that they understand the importance of dangling on the side of bed before transferring or standing. And when they initially start these medications, they should be asking for assistance when getting out of bed. Coronary arteries supply blood, oxygen, nutrients to the heart muscle. For patients with arterial sclerosis, plaque within the blood vessels leads to lack of blood flow and oxygen to the heart and potentially other areas of the body. Partial blood flow to the heart muscle can cause lack of oxygen and chest pain called angina. If the blood flow is significantly reduced, the heart muscle can die and patient has a heart attack, also known as myocardial infarction. Another classification is vasodilators. The action of this drug is that it decreases the pressure of the heart as it exerts, decreasing the oxygen demand. An example of this drug is hydralazine, also known as apresilene. Vasodilators are a class of drugs that dilate, widen, or relax blood vessels in several ways. Some dilate arteries and veins by preventing contraction of smooth muscle cells. Others cause vasodilation by affecting the CNS. Some drugs work primarily on the arterial system, some more on the venous system, and some work on both arteries and veins. Dilation of the blood vessels decreases blood pressure, improves blood flow to the major organs, and decreases the workload of the heart. Vasodilator. Its action is that it decreases the pressure on the heart that it has to exert, decreasing the oxygen demand. Example of this drug is hydralazine, also known as apresilene. The classification of nitrate, you can think about dilate. Nitrates do the vasodilation by relaxing the smooth muscle in the peripheral vascular system. This helps to reduce the resistance to blood flow. Nitroglycerin is a rescue medication. It's extremely important to understand that this type of drug is contained in a dark, small bottle. It is very sensitive to light. It needs to be stored in a cool, dry place out of direct light or sunlight. The date expiration needs to be monitored, and the patient needs to make sure that they understand the importance of this. There are other nitrate medications such as isosorbide mononitrate, also known as MDR, nitroglycerin, which is a topical ointment, and nitroglycerin transdermal, which is also a patch. These medications are taken on a day-to-day basis and are a maintenance drug to help prevent angina, which is chest pain. But the nitroglycerin, the small tablets that are in the dark bottle, or the nitroglycerin that comes in a dark bottle that is a spray that is given to a patient sublingually, is a rescue medicine for chest pain. When administering nitroglycerin sublingually, the person administering this medication must remember not to come into direct contact with its contents. Either tap the tablet into the cap or wear gloves. Placing it sublingually into the patient's mouth. This medication will have an immediate contact with the mucous membranes and will begin to work within 1 to 3 minutes. The patient may experience a warm tingling sensation, and a flushing appearance may begin to occur with the patient. The patient may experience a headache. They may begin to experience lightheadedness. The patient may begin to become very relaxed. This patient may have elevated blood pressure and pulse initially, but as the vasodilation continues to work with this nitroglycerin, the blood pressure and pulse are going to decrease because of the vasodilation. It's going to relax the cardiovascular system. Your patient may have the complaints of feeling weak or lightheaded. You need to make sure that your patient is sitting and not standing and is in a safe place. You need to make sure that your patient has continuing vital sign monitoring. You can repeat the nitroglycerin every 5 minutes up to 3 times, making sure that you are prepared for further emergency response if after the 3rd nitroglycerin administration does not relieve the chest pain or the angina. Beta-adrenergic blocker affects the autonomic nervous system. It blocks the stimulation of beta-1 myocardial cells. It relaxes the fight or flight response. Some examples of this drug is atenolol, known as tenormin, metoprolol, known as toprol, nadolol, known as Corgard, and propranolol, known as Inderal LA. It does lower the blood pressure, but it also affects more of the heart rate than it does the blood pressure. These are the patients that when you auscultate their blood pressure, you're going to find that it is a little bit harder to hear the blood pressure, but it's going to slow down the heart rate more so than it does lower the blood pressure. Patients that have tachycardia are more than likely to be prescribed a beta-adrenergic blocker, such as atenolol or metoprolol, nadolol. A lot of patients that have migraines or anxiety are very frequently prescribed propranolol. Because this drug can lower the heart rate, it has been known to cause dizziness when patient's position is changed, and it also can cause orthostatic hypotension. Angiotensin converting enzyme, known as an ACE inhibitor, stops the enzyme that converts angiotensin 1 to angiotensin 2. It stops constriction of blood vessels. Examples of captopril, known as Capitan, enalapril, known as Vasotec, fosinapril, known as Monopril, and lisinopril, known as Provenol. ACE inhibitors have been known to create or contribute to a dry cough. It's recommended that patients use sugarless gum or candy, that they have frequent sips of water, or increase their fluid intake in moderation. Angiotensin receptor blockers, known as ARBs, block action of angiotensin 2, preventing constriction of blood vessels. Used when ACE inhibitors are not tolerated. Examples are irbesartan, known as Avapro, losartan, known as Cozar, valsartan, known as Diovan. Calcium channel blocker dilates the arteries to decrease peripheral vascular resistance, reduces the workload of the heart, decreasing blood pressure. The examples of these drugs are amlodipine, known as Norvasc, diltiazem, known as Cardizem, nefemptamine, known as Procardia XL, also known as Adalat, verapamil hydrochloride, known as Calan. A platelet inhibitor. The action of this is to prevent platelets from clumping together to form clots. Examples are clopidogrel, known as Plavix, and aspirin, known as Accutrin. This is used in low doses, such as 81 milligrams, to decrease the risk for heart attack and stroke in older adults. One thing about platelet inhibitors is that it slows down the platelet clumping time, or the platelet aggregation, meaning that the platelets do not clump together and form a blood clot as fast as they would normally do for someone who does not take a platelet inhibitor. So when someone cuts themselves who's taking a platelet inhibitor, bleeds a little bit more of a longer time than someone who does not take an aspirin or a Plavix. This person would have a tendency to bruise a little bit more easily. So falling would mean that they would bruise quicker and more frequently. A vitamin K antagonist. Its action is to reduce or prevent the formation of vitamin K in the intestinal tract. An example is Coumadin, also known as Warfarin or Jantoven. A patient who takes a vitamin K antagonist such as Coumadin, Warfarin, or Jantoven would also bruise a little bit more easily because the platelet clumping time is slowed down. This patient is not recommended to take an aspirin over the counter or any other NSAID because it would make the clumping time even slower, making the bleeding even more heavier. So if you had to recommend something over the counter for this patient to take for their headache, what would it end up being? Would it be ibuprofen, or would it be Tylenol, acetaminophen? These are the patients that you would want to recommend that they use a soft toothbrush, an electric razor, that they may want to stop their medications about 5 to 7 days prior to a procedure, and that they take their medications the same time every day, and that they not increase their vitamin K intake. That also means the leafy green vegetables, because that is actually the antidote. It contains that antidote which would increase the platelet count, which would cause the clotting. And these drugs are trying to stop that clotting process, because they already have a problem with their blood clotting, and we don't want that to happen because they have constriction or plaque in their blood already. So giving them these drugs are helping that problem, and we're trying to prevent the blood from clotting. So if they take vitamin K is going to cause the blood to clot. So if we tell them not to eat a bunch of salads, then that's going to help the process, and it's going to help prevent their blood from clotting, and it's not going to give them that antidote that we don't want them to have. It's important for the patient to understand that if they develop bleeding gums, gastrointestinal pain, black tarry stools, or even a rash, that they report these signs and symptoms to the healthcare provider promptly. A prothrombin time, known as PT, normal value is between 11 to 12.5 times greater than the control. The international ratio, known as INR, is between 1.5 and 2.5 times this if on warfarin or Coumadin. Usually the physicians will like to see the INR above 2.5 if the patient is on Coumadin. They like to have a baseline drawn of a PT INR before the patient starts on Coumadin, and then have a PT INR drawn after the patient has taken Coumadin for a day or two. After the patient stays stabilized, meaning that they have a consistent lab value result that stays above 2.5, then they will have the lab drawn about every 3 months, and as long as the lab stays the same, they'll continue on the lab draws about every 3 months. The primary purpose of the International Normalized Ratio, known as INR, in the contents of anticoagulation therapy, it reports the effectiveness of anticoagulation therapy. That's why a PT INR is drawn. It's extremely important to know what these results are before administering any type of Coumadin to a patient. Without knowing these results and administering the medication, you can create your patient to be toxic and can create a GI bleed. So it's extremely important to know what these lab results are before administering this medication. And if you don't know, the safe thing to do is to hold the medication and to get an immediate PT-INR drawn, find out what the results are, and then proceed with current physician's orders with the Coumadin dosage before continuing with administering the medication. Low molecular weight heparin. The action is to prevent the formation by interrupting production of cofactors that help in clotting process. Example is Levinox or enoxaparin, given as subcutaneous injections in patients at risk for developing deep vein thrombosis, known as DVT. While taking any of these low molecular weight heparins, you would still want to avoid taking any type of NSAID therapy for the same reason that you would want to avoid taking the same NSAID therapy if you're taking an antiplatelet or any type of other anticoagulant therapy. Indirect thrombin inhibitors. The action is indirectly prevents the conversion of prothrombin to thrombin by increasing the amount of active antithrombin 3, a substance that interferes with that conversion. The examples of these drugs is heparin sub-Q and heparin IV. The antidote for heparin IV is protamine sulfate given IV. Heparin is given by two different routes. Subcutaneously, normally in the fatty tissue of the abdomen. There's been a few rare occasions I've seen it given into the fatty tissue of the deltoid, and that's in the posterior part of the fatty tissue of the deltoid, and intravenously. Fibrinolytic drugs, also known as thrombolytic medications, dissolve blood clots, clot buster. Examples of these drugs are alteplase, known as TPA, and tenecteplase, known as TNK-ACE. The primary effect of a thrombolytic drug like TPA, tissue plasminogen activator, dissolves clots that may have already been formed. There are several different types of possibilities of side effects or undesirable side effects that may be experienced by patients who receive epinephrine. Tremors, nervousness, tachycardia, hypertension, anxiety, flushing. Some patients may experience the heaviness in chest or may also say or state that they experience chest pain. Erythropoiesis stimulating agent, also known as ESA, is a medication that promotes blood cell development. The action is that it stimulates the growth of the red blood cells. Darbepoetin alpha also known as Aranesp, and eopotin alpha, also known as Epogen or Procrit. These are subcutaneous injections, normally given once a week in the abdomen as subcutaneous injections. These are given at a 45-degree angle. Erythropoiesis-stimulating agents. Because these are given as subcutaneous injections, they have a tendency to act fast in helping to build up the anemia response and duplicating the red blood cell formation. Iron deficiency anemia are used to treat iron deficiency anemia, which develops when there is not enough iron available for producing hemoglobin and maintaining tissue oxygenation. Examples of this drug are ferrous sulfate and iron dexatran. Ferrous sulfate is given as an iron pill orally, and iron dexatran is given as an IV infusion. This medication is generally difficult drug to tolerate at first, but there are some things the patient can add to the diet to help. The difficult tolerating is usually temporary, but for how long? If the patient adds citric juice, such as orange juice, it can actually help to break down the tablet a little bit faster. Patient is recommended to take a stool softener because this medication does contribute to constipation. It is not recommended that the patient take Tums with this medication because not only can it contribute to the constipation formation, but it can interfere with the absorption of the iron uptake. This medication does contribute to causing dark, teary stools. Therefore, if a GI bleed does occur, it would be difficult to distinguish which is it, the iron medication causing the dark, teary stools or the GI bleed. If there is noted foul, smelly stools, that should be reported to the healthcare provider. Likely that would be the GI bleed. Side effects of the GI disturbance should only last temporarily. If the side effects continue to last beyond 10 days, it should be reported to the healthcare provider for the healthcare provider to determine if this medication should be changed or if other intervention needs to be provided. I'm curious to know, if you had to explain angioedema, what would be the symptoms that you would tell someone or your patient to look for?